Hi, I'm Sandra Igwe. I am the Chief Exec at the Motherhood Group. I campaign for Black maternal health, all things Black motherhood, making sure that we have equal access in maternity care, perinatal care, and across the healthcare system.
I'm Tim Edwards, and I'm campaigning for the improvement in risk management and safety practices around pulmonary embolism diagnosis and care.
Hi, my name is Sujin John. I'm a patient safety activist and a pharmacist and a co-founder of Patients for Patient Safety US. It comes from my personal experience as a caregiver for my father. He was a foreigner in this country of United States where he experienced many gaps of care, and one of them being medication adverse events.
I started campaigning based on my own personal lived experience, seeing that there were so many gaps in the system and not many services or providers address the gaps in the system of health inequalities, disparities regarding to Black women's healthcare rights in maternity care, and seeing that there weren't enough voices that were speaking up about this really crucial issue. You know, Black women are more likely to have, depression in our maternity care. We're more likely to have neonatal deaths, and yet there wasn't really that many at the time platforms, really advocating for this issue. And now, 7 years on, I'm really glad that there are so many other initiatives and campaigners, speaking on the same topic.
So I started my campaign after the passing of my mother, where we found that she had been misdiagnosed. A lot of opportunities were missed to diagnose the condition that she suffered from, pulmonary embolism, and to treat it accordingly. And upon review of the case, we found that not only had things gone really badly wrong, but also at a national level, this was happening more broadly.
It's really important to get lived experience and patient and public voices involved in, campaigning work, because essentially we know what we would like to see change. We know the issues, we know the barriers, we know the challenges, and we know it from a lived experience perspective, which is the most authentic way to advocate for change. Without having at the heart the community, it's really impossible to pioneer change or to make change relevant in our lives.
So I think it's important to engage with patients and families because of our outside experience and our ability to question what has happened. When there is a tendency from frontline practitioners, I feel from my experience, to not necessarily cover up, but to be defensive over what had happened and what has gone wrong, and not to be preemptive on the ground to look at things as they occur. There's a lot of unexplained deaths from the condition my mum passed away from that in other industries would be considered a major event. So I think it is important for patients and families to question what's happening.
The patients and family members are the end users, or I know sometimes we call them consumers of healthcare that they are receiving. And if we are not receiving the feedbacks, if we're not open to those feedbacks, the consequences of what they're experiencing is lost.
One of the main issues I've had is getting the system to acknowledge the part or the role that race and or racism plays in poorer outcomes for ethnic minority and Black families and mothers when accessing maternity care. It's, a lot of deflection, being in denial, justification as to why these statistics exist. However, we as, Black service users understand what it's like trying to access safe, culturally competent care and not having that because of that barrier and because of the role that racism plays.
The healthcare is traditionally a very hierarchical organization, and that has been a challenge to convince leadership to listen to patients and families. That is one of the most challenging aspects of patient advocacy. And also, patients and families feel they don't have power to change, So that's another aspect that we try to empower patients and families, that they have voices and they do matter.
At the time that I engaged with the relevant teams responsible for reviewing the care of my mother, I felt that there was a lack of objectivity, very much a shrug the shoulders kind of approach, that these things can often just go wrong, and that's just what we have to accept. I think, to be fair, nowadays via the PSURF initiative, that there is a lot more culture for reviewing patient safety on the ground and reviewing cases in a more proactive way. It just wasn't the case when I was looking into it.
One of our biggest successes is launching the first Black Maternal Health Conference UK, where we had, policymakers, MPs, lived experience mothers, families, doctors, charity CEOs all come together in one space discussing the key issues that affect Black maternal health in the UK, and also practical recommendations and solutions for improvement, and making national headlines on TV, across TV channels, and making sure that the conversation didn't just start and stop at the conference.
So one of the aspects of my campaign is in joining with Thrombosis UK and Patient Safety Learning to reinstate the VTE risk assessment tool, which was mandatory pre-COVID, that in the last few years has been dropped from frontline care. It had been accepted and adopted in the past, and yet it hasn't been reinstated. So I think getting a focus on that, getting it back in place, is something that's being discussed and potentially will be put back in place later in 2023.
So we've done marches for World Patient Safety Days for a couple of years, organized by us. Although it was very small, it's expanding. And also we've done some webinars with other countries that have investigative authority at federal level.
My advice to anyone wanting to campaign is to not take no for an answer. You might have many hurdles, many obstacles along the way, and it's very normal for you to be met with lots of resistance, a lot of doubt, and a lot of no's. But if you keep pestering, if you're consistent, if you know exactly why you're campaigning, if it's a real cause that you believe needs to be addressed, then keep going. Eventually someone will listen, and that could be a catalyst for long-term change.
Being aware of what happened and where things maybe could have gone wrong by looking at other cases, looking at Patient Safety Learning's website, looking at the likes of HCIP, which does independent reviews of where things have gone wrong for whole families of conditions. So understanding in the context of what happened with you and your loved one, in respect of what's been seen elsewhere nationally, is the first perhaps point of call on what I did, and then reaching out from there to experts who often are only quite happy to talk off the record as to your experience for their own benefit. Ultimately these people motivated to give excellent frontline care and deliver great outcomes. So with that sort of strength of knowledge and support often from experts, I think you'll find that you can actually achieve quite a lot.
When your story is resonated by others, the energy and the power that you have increases without a question. So it is so important to find the people that you can resonate with, who are willing to help you.
They've said that it's been, really, I guess, a breath of fresh air to have lived experience involved in work that they believe is important as well. Sometimes engaging in policy changes or systemic changes over the last years haven't really included patient and public voices, but now bringing us not just at the end of a discussion, but at the beginning of a conversation is really insightful. And they've been able to learn loads, directly from people who have accessed their service and who have been affected by some of the issues pertaining to health and health inequality. I guess for me, patient safety is crucial to ensuring that the healthcare system runs as smoothly and efficiently as possible. I know for many people it might be like a new phenomenon, but I think admitting that patients and our safety is just as important as any other aspects in a healthcare setting is the first step to wanting, real long-lasting change, and not putting it as a sideline or an additional sort of add-on, but making sure it's at the heart of every interaction, every engagement that clinicians, healthcare practitioners have with patients, is making sure that they feel safe, they believe they're safe, and that trust is, built through believing that their family members, their colleagues will also be safe as well.
The improvement over engagement with patients and clinicians, I think, is largely going to be dependent on the success of what's called the Patient Safety Incident Response Framework, or PSIRF, as it's been laid out in the UK.
I want to emphasize that empathy and compassion, it's a full circle. That's what I realized. So I want to emphasize that to fellow clinicians and patients and caregivers. Thank you.